Shiva, are you able to see my screen?
Yes, sir, it is visible.
Okay, guys. So, hi everyone, this is Dr. Akram. We are from Sydney. So, today I'm going to discuss regarding the opportunities for dentists in Australia. Okay, so this is a very short kind of webinar, but it's more kind of like the interact with me. So, if you have any questions, doubts, or anything, so please ask. My voice is clear.
Now it's clear, sir. Please talk, sir. Please talk.
Okay. So, hello everyone, this is Dr. Akram here. So, today we are going to discuss regarding the opportunities for dentists in Australia. So, if you have any questions or any doubt or anything, you can ask me in English or in Malayalam or in Hindi. So, Shiva already in your college, so he will try to address in Malayalam. English and Hindi, I will take care. So, we are a Australian edtech company and we provide the assistance for all healthcare professionals like medical doctors, dentists, pharmacists, nurses, lab technicians, physiotherapists, optometrists, veterinary doctors. So any healthcare professional looking to migrate or looking to practice in another country, so you need to write some exam, and that for that country, you need to register yourself as a registered healthcare practitioner. Then only you can work. The same case in Austria. So I can give you another good example. If someone completed like dentistry outside India or medicine, now they want to come back to India, so they need to write the exam, for example, like FMG for MBBS students. So once they pass FMG, then only they have to go for 1 year internship in India. Then only they can practice in India. Same for you. If you are looking to practice in Australia, you have to complete 3 steps. One step basically for this document verification, then ADC exam, then English test, and then you can migrate easily to Australia. So we provide all at Academically provide all these assistance. So easily you can complete all these steps and you can migrate to Australia. This is a little bit about myself. So I'm basically an Indian pharmacist living and working in Australia. I'm basically a clinical pharmacology lecturer at University of Sydney. So where I did my PhD in clinical pharmacology. So I'm around 10 years of teaching experience in India, Malaysia, and last 6 years I'm living and working in Australia. We are some of the faculties for this course. So the scope of dentistry in Australia, you can see from this just only in one slide. The cost of treatment is very high in Australia because the dentists are not many available in Australia, especially So for this doctor, for this patient, basically he has to do this much with like I need the extraction and root canal and crowns and implants. Okay, so the Australian doctor, they give him, the quotation that 100,000 Australian dollar or like in 55 lakh rupees Indian they want from this guy. Okay. So what he did, he just, Google, then he find a one doctor in Hyderabad and he traveled to India and he stay in India for 2 weeks, and roam here and there, and he only around, so he saved basically 85,000 Australian dollars. He only spent 15,000 in India, Australian dollar, means about around 7 to 8 lakh. Rest of the money he saved and get back to Australia. So many people are in Australia. It's like unaffordable for them this dentistry cost. Okay, so the cost is very high in Australia for dentists. The dentist can earn a lot money in Australia. This is one of the story you can see. This is the SBS. This is the government supported media in Australia. So they publish a lot of articles, different languages. This was in SBS Hindi. They published this story. So Australia provide 190,000 permanent visa basically. So easily you can get PR visa, permanent visa once you pass this exam. Okay. And there is a lot of jobs are available. Here the job advertisement right now, 2,200 means that one job advertisement might need two dentists, might need three dentists. So the job vacancies we can multiply. These are just the order advertisement. And the average salary for dentists in Australia around 180,000 Australian dollar. So nearly 1 CR Indian rupees, I can say. So this data is from basically seek.com.au. This is the number one website in Australia if you are looking for any kind of job in Australia. Okay, so they are showing that this much advertisement on their website is available, and I'm just telling only in one website. There are so many other websites are also there for the jobs. Okay, and there is a growth for next 5 years around 28%. They are projected job growth in next 5 years. So they need more dentists in Australia. And if you see that this is the average salary around 1 CR per year in Australia, job satisfaction also very high. Out of 4, this is a 3.9. Okay, dentists are very happy. They are happily they are living and working in Australia. And there are several other advantages to migrate to Australia as a dentist. So first of all, the education for your kids. If you are married and you are migrating to Australia, the education for kids are free in Australia, and healthcare access. So if anything happened to you or your family, it is free of cost. They will take care for yourself. And professional development, basically, for example, if you are working as a dentist, one of the clinic or in the hospital, then yearly 1 to 2 times you can go if you want to attend any workshop or you want to do any short course or any webinar or conference you want to attend. So they will take care of from the entire money whatever is going to be spent on this event to upgrade yourself. And quality of life or work life balance, particularly in Australia, you need to work only 38 to 40 hours per week, means maximum 8 hours per day. You need to work for 5 days. Okay, so you have a lot of time to give your family. You can take care. So work life balance easily, you can manage your families, or more than that. So what are the steps you need to take in order to migrate to Australia? How you can become a dentist, registered dentist in Australia? So basically there is some steps you need to complete. The step one you have to go for called initial skill assessment, or we can say it is a document verification from where you did your dentistry degree. So anyone completed 4-year bachelor degree in dentistry, they are eligible to apply, and they must be a registered dentist in the home country. So this is the eligibility, basic eligibility. There is no work experience required. Obviously, if you have work experience, that's good for you. Okay. And then once this completed, so this step one we will help you to complete, so no need to worry. This step easy, very easy step. And then the step two, basically you have to write this ADC written examination, and this is an online exam, and you can give from your home country. In India there is centers is there, so you can write this exam in India. And once you pass this exam, then you can also need to give English test. Okay, so these three steps you can complete it in India itself, and this is a clinical exam or practical exam, or we can say it's called OSCE. Okay, so OSCE you need to give in Australia only. Okay, this exam, the final step, you have to come to Australia to complete this process, and then you can become a dentist in Australia. You will get the full registration. So many students ask me this question that once we completed ADC Part 1, whether we are eligible to work in Australia or not. Yes, you are eligible. You can work. You will get a limited registration while you are completed ADC Part 1. Okay. So in that you can work as a dental assistant, hygienist. You can assist basically, you can work in the dental clinic, and simultaneously you can prepare yourself for ADC 2. Okay. So many students, they come to Australia on a study visa or any other visa, they complete this process and start working and earning, and simultaneously they prepare for this ADC Part 2 exam. So English requirements, you can give IELTS, OET or PT, any test you can give. And we need 7-band individual in IELTS, or OET B band, or 65 in PT. So as a dentist, for you, OET and PT are easier as compared to IELTS. You can choose PT or IELTS. Highly recommended for you. Go for these two exams. For the skill assessment document verification with ADC or Australian Dental Council, basically they conduct this exam. So they need to see your degree, whether you are a bachelor degree holder, master degree holder. You will see your degree, then your transcript. If you have any work experience and valid passport, ID, government ID like Aadhaar card or any you have driving license or any other or government size passport photograph, dental registration as a dentist in your home country, and good standing certificate from Dentistry Council. So these are the documents you need to submit for ADC, Australian Dental Exam. ADC exam basically, around they will ask you the 280 multiple choice questions, and some of them are like, they are like case based scenarios. Okay, so each case they will give you, and for that they will give you the 5 related questions for that case. Okay, the maximum hours around 8 hours, and you need to grade A or B, need to score if you need to pass this exam. Okay, and no negative marking for this exam. So you have to attend all 280 questions in within 8 hours. And we will provide you the coaching for 4 months to pass this exam. Okay, and here you will get, this is not one set 8 hours. I mean, you will get in between you can take some breaks. So once you completed these two exams, both exams if you pass, ADC part 1 and part 2, then you can apply the PR visa 190 or regional sponsored visa 491. And in those are have 2 year work experience, they also can apply the work visa as well. These are some of the fees. I think Shiva can give you the more information. And we provide assistance also, financial assistance. You can pay all these fees like in 3 months, 6 months, 9 months, and 12-month EMI plan, and without paying any interest. Okay, so we provide loan assistance without paying any interest. This is from the Edu1. This is our financial partner in India. So here are some of the reviews from our students. So now we can talk one-on-one if you have any questions. Yes, Shiva, I mean, we can take some questions from students. Or maybe, Shiva, if you can just brief in Malayalam for a few minutes.
Sure, sir. Sure.
The examination is for general dentistry and specialist exam.
Sir, Principal sir has asked it out. The exam is going to be, based on general dentistry or specialized dentistry, or it is going to be a common kind of examination.
It is a general dentistry mainly. They focus on your previous syllabus only, most likely.
With your specialized dentist, you have any separate exam?
For specialized dentistry, is there any separate examination, sir?
Basically, you cannot be like a specialist in Australia. You have to pass these exams. Then you have to complete residency in Australia around 4 years to become a specialist in Australia.
Yes, sir. Basic examination, now, when 4 years old, it was 10. Other than that, yeah.
So, pass percentage of the overall stats.
Percentage, how much the mark should be taken? Okay, 50%. 50%.
I mean, Siva, I think sir is asking the passing mark part, right?
Pass percentage for the exam. Yeah. How much percentage?
Siva, can you please ask me?
Sir, how much mark is required to pass the examination?
Yes. So basically, here is that there is no percentage system like 40%, 50% marks required to pass the exam. They will give you basically a B, C grade. If you got grade A and B, you will consider as a pass. So they will see basically how many students sit in that exam and they will calculate the percentile. Okay. Based on that, they will give you the A, B, C grade. If you got B or A grade, you will pass the exam.
Okay, once the pass theory, then any practical examples there?
Sir, can you please repeat about the practical examination part of it?
You are not audible. Come to closer to the mic and then speak.
Is it audible now?
Not really. You can speak.
Shiva, can you please repeat, or if you can just type your question so I can read?
So they were asking about the practical examination, sir.
Practical examination.
Yes, sir. Practical examination after this theory examination.
Yes. So this is the ADC part one is a multiple choice question based on your theory, but next exam is the ADC part two. This is also called practical exam or clinical exam or OSCE exam. So for that exam, you need to come to Australia to give this exam. So there is a practical exam.
So basically, the first examination is going to be a theory examination. From India itself, we will be writing the English assessment test also. Okay. After clearing both of the same, they will be getting a limited registration. So with a limited registration, they need to work under a supervision. They will be working as an assistant dentist there in Australia. Then they need to clear the objective examination, which is clinical examination in Australia.
Pass the first exam. How long? 4 years you get.
No, no. Sir, how long will they have to work as assistant dentist
Again, you are not audible, Siva. Your voice is not clear.
Is it clear now?
Yes, yes.
Yeah. So the question was that how long do they have to work as an assistant dentist?
No, basically this is not compulsory to work for them as assistant dentist. If they want, they can work. They can directly write part one and then they can write part two and become a dentist, But I give them my suggestion for them the easier to pass this exam because they need to understand the Australian practice. To learn that practice so they can work with assistant dentist for some time and whenever they feel confident and then they can write part two and once they pass part two, they will get general registration.
Sir, how much validity does the part one examination have?
3 years. So within 3 years, you need to pass part two.
Suggestion is that their questions are going to be based on the Australian practice, right? So suggestion is that they can work as an assistant, understand the culture and the way they interact with them, so that it can be easier for them to clear this examination. Any other notes? Okay, total examination, the course for the OSCE examination and the written examination is based on the Australian Dental Council norms. So it keeps on changing on their website. So what we can do is that you can reach out to us. We will check the correct amount of fees and let you know. One thing I can help you understand is that unlike other processes, for this entire process, if you see, from the first to the overall step, that is your document verification, your written examination, your English test, your visa processing, your practical examination, you will be paying the government in Australian dollars. Okay? For this entire process, what you need to keep in mind is that an expense of 7 lakhs, maximum 7.5 lakhs, not beyond that. So they have calculated the entire process because for each of the examinations that you write, for each of the document verification that you do, you will be paying money to the Australian government. So your written examination is costing somewhere around 1.5 lakhs rupees. Same in Australia, in the practical examination also, you will be paying about as fees.
that's why it's suggested to take the practical examination after working for a certain time. Because if you are doing the examination fee and you are taking the examination and if you are not able to clear the examination, it's such a thing to take the examination once again, our entire amount that will be taken, both in the case of the written examination, also in the case of the practical examination. So, for these kind of examination processes, proper preparation, so for a we spread to but before that, to understand what kind of questions come. People are going to know what the questions are asking. They will be asking you, right? So if you follow proper preparation and examination, you will clear it. Advanced preparation is required for both of these examinations.
Part one examination is the pass. They will have to sit for the part. They declare the part one exam is passed, and they supposed to pay in the clinical exam. They have to be both.
Shiva, actually, I'm not listening to your conversation because there is a. So if you can just ask me, what sir are asking, so I can, give it the.
Sir, am I audible now? Am I audible to you?
Yes.
Yeah. So the question is that they have taken the part one examination and cleared the part one examination. Okay. Then they are going to Australia and taking the part two examination. Okay. By any chance, touchwood, they are not able to clear this part two examination. Do they have to take the part one again, or just the part two they have to take?
No, only part two.
Only part two, right?
They have to repeat the part two for next 5 times they can. If they fail in within 5 times, then they have to go again for part one as well. Within 3 years. So, but you will not take that much time. 5 times is a lot of you will definitely pass in your first and second attempt.
So, this is after the illegal and I was with JPA. Then the sense of our partnership. First is coming out of the what is the value? Then they wanted to and then after the lower part and what was the line of this case? What the line of approach? Then after the approach, that was the final case. What is the cost of how do you manage? The next thing, what do you do? It's the element of that. We do that, I answer to that again. The basically the whole thing is not to make that. So, put the best and you have then you start it. Then it is not possible for the so it's not possible for you to do first. For you to open that. Then I know that what is this once I know the chapter. Then you listen to it. It's so much. That's another question. So, okay. Then, what is most commonly for your father? Next is your question is clinical thing. What is the most common thing as they discuss? They don't want to and the exam, right? First, the data not taken for the exam is like the video is explained easy. Or you do live legislature, this is examination. Then, all years, serving and then how to that's what I said. Suppose a patient or a client, they have 3 6 right? All that everything. In that case, possible. Everything is like I'm not talking about that. It's not by step by step. That's how we and then that's the sense. Our patient. Okay, our own and then everything they are outside of your smart part and it's all so I think this is sorry, five three attempts I like somebody who is a proper preparation take the exam. That is those answers that person is failing for it. And I was working with the hospital. Questions are not that. But then what we do is get the same. So,
Siva, can you hear me?
yes, sir.
If there is no question, then we can jump on to the another webinar which we have scheduled. You can carry on with the question and answer session. Is it fine? You're not audible, Siva.
Sir, can you please repeat?
Sir, Dr. Akram, you can move on to the next webinar if possible. Amin bhai can hold on for some time.
Yes, yes. Okay, okay.
I'm here. Abdul is there. Yeah. So, sir, you can join.
Okay, okay.
Sure.
Bye. Thank you so much. Bye.
Yes, students.